Hello everyone, my name is Dr. Shehzad Saeedullah and I am a head and neck and anterior skull based surgeon. Welcome to my YouTube channel where we take complex ideas and break them down into simplified forms for all the doctors to understand. So if that is of interest to you, please hit the like and subscribe button and hit the bell icon so that you get all the notifications from the page. So without further delay, let's get into today's video. Today, we are going to be discussing the instruments that the undergrad students may come across during their professional examination. So the first instruments that we are going to describe are those of tonsillectomy. So let us begin. This one is called a Boyles-Davis mouth gag. The Boyles-Davis mouth gag comes in different sizes. This one is the pediatric one and this is the adult one. And it has different retractors that you can see here. The size of the retractor depends on the size of the oral cavity. So you're going to select an appropriate size retractor. The way that you assemble a Boyles-Davis mouth gag is this blade should be facing these prongs. And then there is a lever that you are gently going to press. So pressing the lever, you are going to gently slide this one in. And this is used to hold the oral cavity open during surgery. This one is a metallic plate. The metallic plate is used to suspend the Boyles-Davis mouth gag so that both of the surgeon hands are free during surgery. And this one is a metallic bipod or graphins. The metallic bipod along with the metallic plate is used to suspend the Boyles-Davis apparatus. This is an anterior pillar retractor. The anterior pillar retractor is used to retract the anterior pillar so that the surgeon can work in the tonsillar fossa. This is a tonsillar dissector and it is used to dissect the tonsil of the surrounding muscles. This is a Mayo's towel clamp. The Mayo's towel clamp is used for draping and it is also used to hold the instruments together, such as the suction tube. This is a tonsillar holding forceps. The tonsillar holding forceps is used to gently hold the tonsil and retract it out so that it can be dissected during surgery. This one is a kidney tray. The kidney tray is used to hold different instruments such as a needle holder or any other instruments that will be used during surgery. This is a Nagus curved artery forceps. The Nagus curved artery forceps is used to tie off the lower pole of tonsil during surgery. This one is a straight artery forceps. The straight artery forceps is used for hemostasis and used to tie off any blood vessels that the surgeon may encounter. This is a needle holder which is used to hold the sutures and used for suturing. These are suture cutting scissors. And these one are dissecting scissors. So the surgeon uses this one to dissect off tissues and they'll be using this one to cut off the different sutures. This is Yanker's suction tube. The Yanker suction tube is used to suck off any blood or any secretions that the surgeon may encounter. This one is an adenoid curette and it is used for adenoidectomy. The second set of instruments that we are going to be describing are those of nasal surgery. So let us begin. This one is called a Killian's nasal speculum. A Killian's nasal speculum is used to open up the nostrils and have a look inside the nasal cavity. It is used during septoplasty or any of the nasal surgeries to have a clear view inside the nose. And again, it comes in different sizes depending on the size of the nasal cavity that is being operated. The second instrument that we are describing is called a Tilly's nasal dressing forceps. A Tilly's nasal dressing forceps can be used for nasal packing and it is also used in other surgeries such as septoplasty. This instrument is called a Freer's periosteal elevator. It is used in septoplasty to expose the septal cartilage. This is called a needle holder. It is used for suturing. This one is a Killian's nasal couch. The Killian's nasal couch is used to remove the bony spur or maxillary crest during surgery. And this one is called a hammer or a mallet. So the way that these work is, you will place this on top of the bony spur, and then with the hammer, you are gently going to strike. These are called the non-tooth forceps, and these are the tooth forceps. They are used to hold different tissues during surgery. These ones are called ethmoid curettes. The ethmoid curettes is used in order to remove any mucosa from the sinuses during nasal surgery. And again, it comes in different sizes. This one is a kidney tray. It is used to hold different instruments during surgery, such as a scalpel or any of the instruments that we just described. These are dissecting scissors that the surgeon may be using during surgery. And these are turbinectomy scissors that are used to cut off the turbinates during surgery. This one is a suction tip that is used to suck out any blood or any secretions that may be there during surgery. This one is called a Tilly-Henkel forceps. A Tilly-Henkel forceps is used in septoplasty, and it can also be used in other nasal surgeries. This is called a lux forceps. A lux forceps, as again I pointed out, this is used for septoplasty and can also be used for turbinectomies. I see most of my students struggling differentiating a lux forceps from a tonsil holding forceps. So you can see the tonsil holding forceps is very much straight at its lower end, whereas a lux forceps is slightly curved. Let us proceed on to the instruments. So let us begin. This is called a self-retaining mastoid retractor. The self-retaining mastoid retractor is used to keep the surgical field open so that the surgeons can use both of their hands during surgery. As you can see, this is how it is used to retract tissues off, and if you want to close it, then again press the lever and gently close. This one is an ear speculum. The surgeon may be using this to have a look inside the sternolateral canal, and it is used in a lot of ear surgeries such as laryngotomies, chromats, tympanic membrane reconstruction, and also stapedectomies. This is a scalpel with a blade on this end. It can be used to cut off different tissues during surgery. This is a tooth forceps, and this one is a non-tooth forceps. Both of these are used to hold different tissues during surgery, and you can appreciate the difference between the two. There's a slight tooth protruding out. This is a laryngotomy knife. It is used to make a hole in tympanic membrane so that the fluid in otitis media with effusion can drain out, or it can be sucked out. This is a needle holder. It is used to hold sutures and is used for suturing. This is a curved needle. It is used to raise off the tympanomeatal flap and also raise the tympanic annulus. Stop. This is a curved needle. It can be used to raise the tympanic annulus during reconstruction of tympanic membranes. This is a Rosen's canal knife. A Rosen's canal knife is used in the elevation of tympanomeatal flap during tympanic membrane reconstructions. This one is a Plester knife. Again, the same use. The Plester knife can also be used in raising the tympanomeatal flap. This is a sickle knife. It is used to make cuts in the tympanomeatal flap so as to fashion it during reconstruction of tympanic membrane. And this sickle knife comes in different sizes, as you can see. This is a crocodile forceps. It is used to hold different tissues during ear surgery. This is a micro scissor. It is used for cutting tissues during surgery, and as you can see, these are the ones which are curved to the right. And these are also micro scissors. You can appreciate the curves, and this one is curved to the left. Lastly, we are going to touch some of the instruments that may be used in neck surgery. Let us begin. This one is a sponge holding forceps. It is used for cleaning and draping the patient. This one is called a DeBakey's forceps. It is used to hold different tissues during surgeries. This one is a tooth forceps, again used for holding tissues during surgery. This one is a Langenbach's retractor. It is used to retract off muscles so that the surgical field is clear and visible. And again, it comes in different sizes. These ones are Langenbach's retractor but smaller size. This is a cat's paw, as you can see. It is also used to retract off tissues. And these one are skin hooks, which are used for holding skin during dissection. This one is a straight artery forceps. It is used to dissect off tissues during surgery and is also used for hemostasis. This is an isthmus retractor. It is used in tracheostomies to retract off the isthmus from the tracheal rings. Again, this one is a scalpel with a blade on its head. It is used for cutting different tissues. This is a needle holder. Again, it is used for suturing. These are the suture cutting scissors. And these are surgeon scissors or dissecting scissors. This one is a tracheal dilator. It is used to dilate the trachea so that the tracheostomy tube can be put in. The way this works is like this. And this one is a suction tube. Thank you. Thank you everyone for watching. If there are any more complex topics that you would want us to cover, please let us know in the comment section. Thank you so much.